Good morning, good afternoon, good evening to all participants joining us from different parts of the world. Nice to see each one of you as participating actively in the chat. I hope our Q&A session will go just as well. My name is Chisanga from the Eastern and Southern Africa Water and Sanitation Regulators Association, and I am delighted to officially welcome everyone to the fourth webinar in our Sanitation Data and Operational Management Systems. This is a webinar series which is part of the Sanitation Data Systems Strengthening Project in Africa. So when we say data and operational management systems, we mean systems that enable utilities to define their key data needs. This is to generate, to analyze, and operationalize data, not just for service delivery, but also for internal performance management. This webinar series is brought to you by Dev-Afrique Development Advisors in collaboration with ESAWAS and the Global Water Operators Partnership Alliance, GWOPA. I think someone needs to teach me how to say this, GWOPA, but I think I got it right. So this dynamic partnership has been brought together, and has brought together organizations whose mission it is to support the development of sustainable and inclusive public service systems across Africa. Combining expertise and passion to deliver an impactful and inspiring series, this webinar series will spotlight water and sanitation data and operational management systems used in Africa and South Asia. We are also excited to let you know that there will be a meet and greet session on GWOPA's Urban Sanitation and Community Practice Platform following this webinar. This will be a fantastic opportunity for you to interact with our speakers and to ask any further questions you might have. There's also an opportunity for participants to meet other key sanitation stakeholders on the ESAWAS Engage platform. So at ESAWAS, we believe in saying that if you want to go fast, go alone, but if you want to go far, go together. And recognizing this, recognizing that a key to improving access and quality water supply and sanitation services, we must go together. ESAWAS has combined a number of regulators that play a pivotal role in balancing the interests of government, service providers, and consumers. And therefore, we have created this platform, the ESAWAS Engage platform, for regulators to lend a close listening ear to the voices of the sector. Therefore, I encourage you to engage with us. We will post the registration links in the Teams chat. My colleagues will be posting the registration links in the Teams chat throughout the webinar, so please be sure to keep an eye out. Our agenda for today, we will be covering welcomes and introductions. We will then go to the presentation from the Lusaka Water and Storage Company on their Lusaka Sanitation system. Of course, we'll have a quick 5-minute break. We encourage you to use this 5-minute break to jot down any questions you may have in the Q&A. And thereafter, we'll have a Q&A session, next steps, and we shall close. Just a few housekeeping notes. This webinar is being recorded, and the recording will be shared with all participants afterwards. We do encourage you to keep your microphones muted throughout the presentation until the Q&A session is live and active, where you will get a chance to raise your questions. And if you have any questions during the presentation, we also encourage you to use the chat feature. There's a chat feature as well as a Q&A feature where your questions, your comments, and remarks can be addressed during the dedicated time. And feel free to continue engaging with us during this chat. So this webinar series is part of a broader public service data systems, landscaping, learning, and technical assistance project that has been developed by Dev-Afrique. This initiative has been funded by the Bill and Melinda Gates Foundation in an effort to strengthen sanitation data systems across the sub-Saharan Africa. The project's activities are around 5 main areas: to improve the understanding of data systems, to improve the understanding of data system strengthening, the best practices from non-WASH data systems like health, to also improve the understanding of the current state of non-sewer sanitation data systems, municipals, and utilities in sub-Saharan Africa. It is also to support the development of and the pilot of the WASH data systems data maturity framework, which has been developed by ESAWAS. And this landscape will also develop an inventory of successful WASH tools in South Asia as well as sub-Saharan Africa. This will also give us an opportunity to provide technical support and facilitate cross-learning and insights sharing on data systems best practices. Again, this webinar series is tied to the WASH tools mapping focus area, and we're looking to promote shared learning to enhance sanitation and data systems used for improved service delivery and performance management in utilities and municipalities. It also offers WASH stakeholders across Africa a platform to collaborate and improve sanitation service delivery. So during this webinar, you will gain exclusive insights into the Lusaka Sanitation system and learn how it can enhance decision-making, service delivery, performance management in the WASH sector. You will also have the chance to connect with peers and industry leaders to explore ways to strengthen sanitation data systems. As a reminder, this webinar is brought to you by Dev-Afrique Development Advisors in collaboration with ESAWAS and GWOPA, and we thank the Lusaka Water and Sewerage Company for allowing us their time to learn from them. Today, we have partnered with Lusaka Water Supply and Sanitation Company, who will spotlight the Lusaka Sanitation system. This system is an innovative tool that has revolutionized the non-sewer sanitation management in Lusaka, Zambia. We have faced a number of epidemics in Lusaka, and the Lusaka team has been using this system in response to the same. We also have an exciting lineup of speakers who will share insights on how this system enhances operational efficiency and delivery and service delivery in Lusaka. And it is now my pleasure to introduce the speakers who will give an in-depth presentation on the Lusaka sanitation system. We will start with Barbara, our monitoring the Lusaka Water and Sanitation Company's monitoring and evaluation specialists. Then we have Kasalwe, who is the Data and Systems Quality Management Coordinator. We have Evans, who is the Field Service Management Inspector. And we have another Chisanga, who is the GIS Engineer. And they will all provide an overview of how the Lusaka sanitation system has been integrated into Lusaka's non-sewer sanitation operations and how it helps them work efficiently. So to kick things off, the Lusaka sanitation system is an integrated, web-based monitoring and evaluation management information system that enables the Lusaka Water and Sanitation Company and its key partners to manage service delivery and to monitor access to safely managed sanitation services in the Lusaka province. It is owned and managed by the company, and for more insights, please scan this QR code on the right to download the learning materials on the Lusaka sanitation system. And I will now hand it over to the Lusaka team to continue their presentation.
Thank you very much. Good morning. My name is Kasalwe. I'm from Lusaka Water Supply and Sanitation Company. So I'm going to first delve into our digital transformation journey before we go into the sanitation system. We wanted you to first appreciate how we've transformed our digital systems. So the presentation outline is such that, first of all, we are going to go into the digital transformation journey And then we are going to present to you our on-site sanitation journey. Then we'll go into the Lusaka Sanitation system. And thereafter, we are going to look at the challenges and the LSS enhancement. Then we'll look at the lessons learned, and then we'll also see some of the demos from the system. So briefly, I'll just give you a background of our company. So we're a company which was born out of the City Council, and then we're registered in 1988 and started our operations in 1990. So up until 2008, we were operating basically in Lusaka City, but now the utility is now a provincial utility. And then recently we extended our operations to rural areas. So an overview of our company. Currently we're servicing about 3 million people, and then approximately 70% of our population resides in the peri-urban areas. So the company has 11 licensed water trusts, and then our supply coverage is 94% water, and then sanitation coverage is 82%. Our total customer base stands at 142,336. So we are located in the heart of Southern Africa. That's just the map of Zambia there. And so we have our vision and mission, and then also our core values. So our company is anchored on our strategic plan, which is currently running for the period 2023 to 2027. So our core objectives are to attain financial viability, to improve customer access to quality water and sanitation services, and to enhance corporate image and customer care. We are also hinged on reducing non-revenue water, and also to improve organizational efficiency and to strengthen institutional capacity. So those are some of our key performance indicators, just to give you an overview of how we are performing. So in terms of metering ratio, we stand at 68% metered connections. Then our production is 283,702 meter cubic. Our collection efficiency stands at 77% of our billed consumption. Our non-revenue water stands at 58%. Our O&M covered by revenue is at 77%. And then water quality is currently at 97%, while effluent quality stands at 51.4%. Then our hours of supply are 17.8 hours on average. So this is our digital transformation journey. I'll just give you an overview of what we envisaged and our future desired state. So our digital transformation journey embarked on having, first of all, mobile app-based transactions. Then we're also looking at embarking on Internet of Things. Then obviously now we are in an artificial intelligence era, so we are also looking at having artificial intelligence enabled systems. Then obviously we want to go green by introducing paperless and green technologies. Then also to have social media enabled platforms. Then we also intend to have integrated platforms or available payment channels integrated with the general ledger, ancillary applications like the GIS, the Lusaka Sanitation System, OSS, and FICO/SLAG management. Also, we're also looking at the call center, SharePoint, and also integrating with banks. So this was our desired state, and this is what has anchored our digital transformation journey. Okay, so our transformation began from the time we came into operations in 1990. So we are looking at a time frame from 1990 to 2024. So when our operations began, from 1990 to 2000, we basically had monolithic systems. These were systems which were basically standalone and paper-based systems. So then when we go to 2001 up to about 2010, we now had some semi-automated systems. And then we also had some basic centralized processing. And of course, we were still data entry intensive, and then largely also monolithic. Then when you go to 2011 to about 2024, we are now looking at integrating our systems and then also having distributed processing and paperless workflows. Okay, so here we are looking at what we now, where we are and where we are coming from. So like I explained earlier, from the time we started our operations, from about 1990 to 2020, we first of all had payment bill notices. First of all, we had over-the-counter payments, manual receipts, paper bills. So that was back then. Then when it comes to application for services, customers had to come in face-to-face into our offices. Then when it comes to complaint handling, we needed to have walk-in customers. And then at the point, we also had the switchboard. Usually people had to call in through our switchboard. But then when you look to 2011 to 2024, we now have gone cashless. So in terms of the customer experience, customers can now transact from the comfort of their seats. We have a mobile app. We also have electronic bill payments. And then we also have smart metering. Then when we look at application for services, we also now have a call center. We have an online customer web portal. We have a website and mobile app. Then for complaint handling, we now have a call center. We have social media platforms and mobile apps. So you can now see that we have enhanced the customer experience from a time when customers needed to walk to our offices, they needed to drive to our offices to come in physically and complain. We now have solutions which enable a customer to transact just from the comfort of their seats. So then as part of the digitization in customer experience, those are just some posters. As of August 31st this year, we have gone cashless. And then at the moment, you can also download our apps on Google Store. And also you also have our call center numbers, 5957 for customers to call in and log in their complaints without leaving their homes. So then when we are looking at the digitization process, we are not just looking at the customer experience, we are also looking at our internal processes as well. So internally, when we look at our payroll, back then from about 1990 to 2020, we had our paper payslips, which had to be given out to employees. But now, when we look forward now, we have e-payslips. So we want to go green, like I mentioned earlier. We want to reduce on our paper workflows. Then in terms of our HR, in the past, we were working with paper leave claims, paper commutation forms, but now everything is online. We can do e-leave applications and commutations. Then in terms of supply chain, initially we had paper requisition orders and manual tender processes. But at the moment now, if you look at 2024, we now have e-tendering and requisition and order processing. So then when you look at our commercial processes, now we are looking at the systems that we've implemented. So from about 2000, we implemented the EDAMS billing system up to now. So we've had EDAMS running with us for the past 24 years. So if we look back from 1990 to 2010, meter reading was basically paper-based with manual input. Even our bills were printed on mailers. We had issues of packing and sorting bills. I'm sure some organizations can relate to this. But now we've gone paperless. We have e-bills, e-reminders for defaulting customers via SMS notices. And now we have real-time meter reading also via phones. Then we've also integrated our billing and general ledger with the financial systems. Then when you look at the receipting modules, back then we had A4 receipts on dot matrix printers. Then there were issues of reconciliations with banks. Cashiers had to be dropped at every pay point. Then there were issues of posting manual receipts. But now we've gone cashless. So we no longer have cashiers, no cash in transit costs. And now we have reduced malpractices as well in terms of handling cash. So then in terms of our operations, here also we are looking at our operations back then from 1990 to about 2010. In terms of maintenance, we had two-way radio communications whereby we had radios installed in all our employees' vehicles to communicate faults and failures. We also had the fault logging system, which was a manual book, and then customers had to walk into our company to log in all their complaints. But now, looking at us now, we have a computerized maintenance management system, and then we also have a call center. So customers can call in using our call center to log in their complaints. So you can see that there's a big transition from way back where we had to use radio communication channels and the manual faults login and job cards manually issued. But now everything is automated using the computerized maintenance system from EDAMS. Then in terms of materials, repair materials, we had a manual requisitioning process for repair materials. And then this was not linked to job cards. We had issues of bulk drawing. So now in 2024, in the new ERP system, we are implementing online requisitioning system, which is going to reduce the issue of manual drawing of materials. We're going to have materials linked to job cards. And then we also want online requisitioning and accountability of materials so that we're able to monitor consumption of repair materials. So this is just now where we are. We have introduced an asset management system, which is also integrating all the various facets of our organization. So from that diagram, you can see that we've integrated the call center, maintenance management. We are also looking at automating field work management, operations. And then in the future, we're also looking at water quality monitoring, distribution, non-revenue management. And then we are basically anchored on asset management, planning, and GIS infrastructure management. Yes, so that's just a screenshot of our current maintenance management system. So from the maintenance management system, we are able to analyze all our different maintenance requests, those which are overdue, those which are pending, those which are outstanding. And then the other image there shows us the integration of all our processes. Everything is anchored from our technical register all the way up to our commercial systems. So our journey has not been without flaws. We've had issues also which we've been grappling with. So we had initially challenges of data quality and integrity issues. So at the moment, these are the issues that we are trying to address in the new ERP. And then we had issues of heterogeneous data sets across the organizations. All these are now being addressed in the new ERP. Internally, we also needed to digitize some of our internal operations, like recruitment, separations, promotions, PMS, and claims are still lagging. These we're still looking at. Then we've also had some issues where we failed to automate some sites because of technological failure. And then we also have security concerns, e.g. data breaches and unauthorized access. We've had some issues where the system has been flawed at some times by employees and even just by other entities. So we are looking at enhancing our security issues as well. Then basically also budgetary constraints. At the moment, we want to expand our system to include the water and effluent quality monitoring modules. So we are hoping that that comes on board quickly. Then we also had issues of operational silos in the company. And this has also made it difficult sometimes to help our system. So we have competing budgets, rival functions. So this is why we now want to embark on an integrated approach where we are more collaborative as a team. Then also this has come with a digital skill gap. We need to handle the lack of proficiency to handle new technologies. So meaning that now staff have to understand how to manage the system in terms of analytics. We need to enhance cybersecurity and advanced software issues. Then we've also had issues of inefficient data management and scalability. Because of surge in volumes of data, the increase in user traffic and load has also affected our infrastructure. So we now need to upgrade our infrastructure for our systems. Lessons learned. So basically we've learned that data quality is key. We need to clean up our data sets, records, workflows, processes before anything else. Then we obviously need to have clear system requirements, definitions, and scope of works to minimize reworks and scope creep. Then obviously we need to have adequate budget lines, which are provisioned even for the potential risks, which are quite imminent. And we need to procure, obviously, hardware in good time. We've learned that sometimes we've had software introduced. Meanwhile, we don't have the hardware in time. Then we have to have ownership by end users by ensuring that they all sign off systems. We found that sometimes end users tend to reject systems after they're deployed, saying they were not part of the process. So it's important to involve end users all the way. And then we also need a resource training budget to sustain knowledge transfer. These are some of the lessons that we learned during our data transformation journey. So in a nutshell, right now we have basically tied up everything. We have integrated our systems. And so we are now just trying to work and ensure that everything is working perfectly. And then we are going now to transition into a very effective utility. I'm now going to ask my colleague, Barbara, to present the Lusaka Sanitation System. So this is just a small background on how we've transformed our digital journey. Thank you.
Hello, good morning. As introduced by Chisanga, my name is Barbara Banguna. I'm going to talk about the sanitation. You know, in Lusaka, we have a lot of people that are coming from the villages to come into Lusaka to probably come and look for jobs, because that's where they think that in town, that's where a job is, and businesses. This has made the rapid growth and urbanization resulting into poor sanitation. Our services expansion has failed to keep the pace. Because of that, everybody is flocking to Lusaka. The gap keeps getting wide due to insufficient resources to expand these services. What are some of the many challenges that we have? We have poor conditions of the toilets, inadequate FSM, low sewerage coverage, weak sector coordination, inadequate compliance, and monitoring mechanism. Given these challenges, it is important to look into the long-term planning that responds to the sanitation needs covering the entire Lusaka province. Next, please. How have we tried to do this turnaround? The turnaround began in 2011 when our Lusaka Sanitation investment was approved. Then we had the birth of the Lusaka Sanitation Program. The Lusaka Sanitation Program is the program which was the first step to implement this sanitation plan in certain areas. It was approved in March and May 2015. Then the Lusaka Sanitation implementation itself started in 2016. Then in 2017, we had to plan, we had to include the on-site and the off-site, the on-site and the FSM. We had an OSS strategy brief approved in 2017. Then in December 2018, we had the BMGF come on board just to fill up the gaps and focus on the CYs. With the changing of the condition of licensing agreements by the NWASCO in 2019, and we had to set up an FSM unit which would sit in the headquarters of Lusaka Water Supply Sanitation Company with full-fledged staff who would now continue with these services. Then in October 2019, there was a change in the utility name from sewerage to sanitation, and this was now a focus. What was our baseline? In 2018, you can look at the sheet flow diagram. We had 17, we were at 17%, and 83% needed to be addressed. And this is a very huge job to do. How did we start planning in order to reduce this 83%. We started putting across interventions that would help us by the external financing. This Lusaka Sanitation program then was financed by 4 financiers. We had the World Bank on board, the LFDB, the EIB, the European Investment Bank, the German Investment Bank, the KfW. These banks came together and financed all the interventions that we were going to do under the Lusaka Sanitation program. The significant strides have been made to improve access to safely managed sanitation by tracking the entire service chain in the city. What is it that we did? The first thing that we did, which we had talked about in our strategy, was to construct toilets in these hotspots for cholera. We constructed new toilets, and we also put up the emptying services and also the treatment plants, just to complete the whole chain. Then for the toilets and the network that was done, we needed people to start connections and improvement of the safely managed sanitation in Lusaka, plus the gaps in the seawise planning to achieve the universal coverage, which is in 2030 as the MDGs. So now, where are we now? You saw that after the intervention of the LSP, this achievement has only gone up to 33%. We still have 67% to address, meaning we still have a lot of work vis-a-vis improving the water protection in the grounds by constructing more toilets and also encouraging people to start emptying using the professionals. In 2018 and around 2022, we had some cholera outbreaks. So these are the areas where the cholera outbreaks are most of the times. In Kanyama, more especially, this is a peri-urban area in our country. In George, in Garden, in Maziopa, in Kalingalinga, all these are peri-urban compounds in Zambia, Lusaka City. Where did we start from? For the FSM, we started providing services in Chainda, Kanyama, Chawama, Matero, Charleston, and Chazanga. Under the project, these are the areas where we started offering the FSM services to our customers. Then for the toilets, the previous slide, please. For the toilets, we constructed toilets in George. For the OSS services, we constructed toilets in George, Kanyama, and Chawama. These are the 3 areas we had picked up on to construct the toilets and see how the interventions will work. Then the sewer network, we constructed the sewer network in Kanyama and industrial areas, Matero and Kaunda Square. Next, please. Where are we now? The current situation is that the FSM services now are citywide. We have even zoned all the areas where these services are being conducted, and 4 providers, service providers, have been contracted to operate in each of the zones. You will find that to complete each other for the safe and coordinated service delivery, the pit latrine emptying and subsidy, performance-based, all these are done in the zones, in the 4 zones that we have done. So previously we were just in 3. When the project is coming to an end, we have spread out citywide. What mechanisms did we use? When constructing the toilets, we had to use the community-based, whereby we would train the communities, the youths and the women. They were the masons that started constructing these toilets. Then we also had a performance-based with the local contractors. So the community-based masons were contracted under the LWSC. These financials were financing separate areas. We had the World Bank, Kanyama, and George for FDB. So for the World Bank, we used the contract-based local contractors. This is what we did. This was just a sanitation shift. If you can see, this is an improved pit latrine. Then under the FDB, we had the next toilet. And then we also had these demo toilets where community would come to choose which toilet they have, because the toilets inside were different. And this is one of the beneficiary who bought a toilet, and this toilet is 2 years old, and we're happy to still find it intact and that they were using it properly the way we had trained them how to use the toilet. So how did we get people to know about the toilets? We used the sanitation marketing approach where to create the demand. So this approach was used in both areas for George and also the Kanyama. We also constructed toilets in schools, markets, and hospitals. We constructed 100 toilets in these facilities, and they were also disaggregated, male and female toilets. We also had put the clamps for the disabled people. And those are the toilets, the transitioning. You can see the old toilets and now the new ones that we had put up. This is just a success story to show that these toilets are helping our communities out there. The success now on the FSM. For the FSM, as the utility was expanding its role, service provision, one of the objectives was service provision. We wanted to make the prices affordable. We also wanted to enhance quality service, maximize intensive incentives for expansion of emptying services in current and serviced areas. We also wanted to test the new and innovative private partnership, enhance resource recovery at the stage of the sanitation chain. The next slide is just showing how many service providers that we had engaged. Next slide. Oh yes, we had engaged. And what they are using, the manual emptying, the PVAC. We also have the vacuum tankers. What else did we construct? We constructed 2 FSTP in Matero and in Manchinchi with a capacity of 180 cubic meters. Next, please. What are the challenges? The biggest challenges that we had were how to get the compounds to want to buy the toilets, because a study which was conducted under this LSP program, most of the people we talked to were saying, when asked about, can you buy a toilet so that your toilet is improved? Most of them would answer, nilibe ndalama. Nilibe ndalama in our language is that I don't have money. So you can see that most of the people we were dealing with, we were marketing these toilets, were not prioritizing sanitation. And being it was different line of business for Lusaka Water. For us to break through, it was really a challenge. We were also developing and strengthening a dedicated unit. It was also a new line of regulation for NOASCO. It was also an informal and dealing in low-income customers, which I have already explained. People will tell you, nilibe ndalama, and non-revenue potential. And when we started conducting this, it was at the time when we had a cholera breakout, and the city was just nervous about putting in a lot of interventions to calm the cholera which had hit the country. Next, please. What lessons did we learn? I think we learned that legal provisions are very important, such as bylaws, because they would enforce some of the communities who really don't want to improve their toilets. Others are willing, and the demand that we have created, we could see that most of the people started coming on board, saying that I need a toilet, I need this, but there are others who are far away from it. Sanitation was not a priority to them unless water. Then partnering with the regulators and local authorities more effective to avoid the conflicts, improved accounting, service baseline and mapping, monitoring tools as well to improve decision and use of the resources. Change takes a lot of time. This is what we learned, especially change takes a lot of time, but you need to push. Providing services, products to the low income requires subsidies, because if your toilet is expensive, then the community will not be willing to have their toilets improved. So you have to subsidize whatever toilet construction you may need to improve in the area. That is one of the lessons that we learned. Then community-based Mansons were better. You will find that the toilets built by the community, these are the youths and women who were trained. Their toilets, after 2 years, 3 years, the toilets were still intact. But for the ones with the contractors, I think they were maximizing on profits, and some of the toilets we had to make them redo them. Building capacity within the utility is essential to adopt the new norms and programs. Equitable investments and services have to be actively kept in focus. Then it's better to start with what you have and improve. Get better as you go. Thank you very much. Now I'm going to talk about the Lusaka Sanitation System. After all the interventions that we have put across, we now needed a system where all the data would be stored and then use the information for strategic planning, also just to inform the country on how we are performing vis-a-vis in sanitation. So yes, Lusaka Water had a system, a very comprehensive system, a monitoring system for operations, and this system had weaknesses. When the sanitation component was introduced, it didn't have the on-site sanitation activities or the FSM management in the system. And the critical data was not shared in real time because we needed a system which was a web-based. Then introduction of the new services that we did, the system had no NS system to manage these services that we have brought on board. Then it also didn't have an M&E component. Next. In terms of the other institutions, yes, the Ministry of Health has a system, and also the Lusaka City Council have their own systems that collect data that can be useful to Lusaka Water to assess the effectiveness of its own operation and vice versa. However, the system for Ministry of Health is a very big system, the MIS system, which is not which is not at the district level. At the district level, they still use some paper-based system where they would get and just enter in the Excel manual, and then one of the person at the province would enter the data in the MIS system, which they have the big system. Then the LCC, they completely didn't have a system. They had a system which they call the Smart PhD. All the parameters for the Smart PhD were similar to our LSS system, and all these systems were to be integrated to the LSS system. Lusaka Water collects information that could be useful in the real time to those institutions. Tasks with ensuring that the population is not exposed to the fecal or the chemical contamination. As Lusaka Water, our mandate, we provide data to the ministry. Data requests come from the Ministry of Water Development and Sanitation. We also provide data to our regulator, NOWASCO. We also share data to ZEMA, and also LCC do the same, but occasionally MOH does that because MOH does that. What is Lusaka Sanitation System? The Lusaka Sanitation System is an integrated web-based online sanitation system which comprises of 3 modules. We have the OSS receipting module, the FSM module, and also the monitoring and evaluation module. This system was developed in 2019 as a result of the need for the M&E management MIS information system, because it was supposed to be integrating with any other systems, and its key partnership to safely manage sanitation service delivery. The objective of this Lusaka Sanitation System is to assess the effectiveness of sanitation and hygiene investment in Lusaka. This is just a login interface. When you open the system for the first time and you have the credentials to enter the system, The first thing that you will see is login screen. You can see we have even put 3 logos because the data will be shared amongst the 3 institutions. The first module in the LSS is the OSS. The OSS system consists of 2 sections. We have the general information section where the customer, applying for the construction of the toilet data is captured. You capture the name, the phone numbers, the residents, and everything. Then the toilet section is where the details of the toilet that the customer wants is captured. The people that capture this information are the customer service. When a customer walks into to the customer service, they would capture all this data until when they make a payment. Next, please. The next one is now the FSM module. This FSM module, my colleague Evans is going to take you through in details. Thank you. I rest my case.
Okay, thank you so much, Mambo Evans are my full names. I will take you through the FSM module. That's the challenge we have when ladies are put first. Their voice projection is quite strong. You need to beat their voice for you to conquer them. So basically, maybe let me just give just a very brief background before we get to our slides with regards to the model that we are using as FSM. So we're privileged to run what we are calling a result-based financing scheme from the financiers such as the World Bank, the 𝗂𝗶𝘀𝗀. Now, such model, we had to come up with a strategy. So we called it an FSM business model. It's a delegated business management model that requires that service providers are incorporated in sanitation service provision along the sanitation service chain. So basically what we did was that we partnered with them under a model we are calling the PPP model, public-private partnership. But something probably I need to mention quickly is that on a performance-based contract that we signed with them for sustainability purposes, now we have since shifted the model. We are going is that we want to reach the citywide inclusive sanitation, because on the initial project we only had the manual operators. So now for us to reach the citywide inclusive sanitation model, we included now the vacuum truck operators whom we are now licensing, so that basically we reach out to the citywide inclusive sanitation service delivery. So now back into the presentation. So what you are seeing there is just basically the FSM module in the system that we also pushed for. And in designing the system, actually, what we planned was that we wanted the system to answer to all the GMP questions. And as you can see from the slide, so when we designed the questionnaire or the documents, we wanted to ensure that it answers all the questions that relates to GMP reporting, so that we don't have difficulties in reporting. So with regards to the FSM module, it provides basically a convenient and easy way of collecting and updating data related to GMP and FSM. And not only that, it consists of the 3 documents. So in developing this document, for instance, a job card, we wanted to develop an assessment, the aspect of the FSTP along the sanitation service chain. The reason was that we wanted these questionnaires to help us in the monitoring of the service providers by the service provider. Remember, I mentioned that Lusaka Water contacted the service providers, and we are not the ones directly providing the service. Okay, thank you so much. So what you are seeing there basically is just the questionnaires or the documents that basically our service providers that they are using in the field, and we wanted as much as possible to simplify them, just looking at the caliber of the people that we are working with. So we ensured that along the sanitation service chain, all the questions that needs to be answered when they are emptying the facility, they are incorporated in these 3 documents. So the job card basically adjusted some basic information. For instance, we wanted to be very sure that the job has been done. So wanted the volume aspect, for instance, to be put on the job card with regards to the assessment. It's just basically a questionnaire that just tries to answer the accessibility, for instance, of the facility. If we are going to empty a facility, are we going? Is it possible for us to, to have access to the facility? But more to it is the fact that we added quite a good number of questions that possibly we are going to help us in terms of reporting. For instance, we wanted as much as possible to record the information related to the customer, the NRC, the customer number, and just other few questions that will help us in data analysis. Then at the FSTP, or at the Fecal Treatment Plant, we basically designed the form that whose goal was basically to just be sure that when the service provider empties sludge from the community, it is still brought to the FSTP, so that we don't have unsafely managed sanitation along the sanitation service chain. So with the requisition register, it's just basically a document that just tries to capture the data pertaining to a customer. Then assessment form, like I explained, it's just a form or a data sheet. Of course, it's in a physical form, but when you go into the system, hopefully I'll have some time to do a demo. It's just basically just try to answer some questions related to a customer along the sanitation service chain. Then our expectation was that the fact that service providers are the one at the ground wanted to reduce also on the risk aspect of, for instance, a payment risk. So what we did was that the service provider would generally collect the resources or a certain percentage of the emptying fee from the customer, and the difference would be claimed now from the project. Then on the job card, basically it was just to authenticate. We wanted to be sure that the job has been done. So there's a provision that makes a customer actually to sign on the job card before these are presented eventually for payment to the FSM unity for their subsidy. Then the FSTP form, of course, like I earlier mentioned, is just one of the monitoring mechanisms at the FSTP to be sure that a service provider has not decanted this sludge anywhere along the sanitation service chain. So it's just basically also one of the monitoring mechanisms at the end of the sanitation service chain, which is the treatment at the treatment plant. Next slide. Okay, so basically this is the form I was mentioning. So on this form, actually, it just has just some basic information. For instance, it acts to some point as a GRN received note for the plant operator, because you want to acknowledge that, okay, sludge has come in with this quantity, and this is now what we could now link with a toilet number, because generally from the point that the service provider goes to the customer, he needs to generate a toilet number. Then at the FSTP, the plant operator now would link that toilet to you would link that FSTP to the toilet number, just to be very sure that this sludge was gotten from these customers as a form of acknowledging that he or they have received the sludge. Okay, so what are the challenges that we encountered along on our course to provide this safely managed sanitation challenges? So one of the challenges that we found was that for SM delegated business model, it requires tight monitoring of data reporting to maintain quality. Remember, the service providers are the ones who are providing you with the data. So if you don't put your foot down to basically ensure that they collect data, it becomes very difficult for us to analyze the data. And the number 2 challenge we see is that the system is yet to incorporate the VTOs, and therefore data capture is incomplete. You see the vacuum truck operators, like for instance in Lusaka, we are running about over 51 of them. So the dashboard basically does not incorporate them, and data reporting on that aspect becomes a bit challenging. Not only that, the volumes of the end product sold not captured in the system. I'll take you through, but with regards to the system not capturing, for instance, I mean, we are at the end of the sanitation service chain, we are producing what we are calling end product, which is manure. So the system does not incorporate how much manure has been sold from the sludge that has been received at the plant. So what are some of the opportunities I will see? So digital on-site sanitation system starts to change artificial assumptions because of evidence. I think long are the days when we used to calculate 1 + 2 + 3. So in terms of data reporting, it's very easy for you to navigate into the system and report whatever kind of data you want to report, whether it's if it's data related to reporting on the basic sanitation facilities that people are using, improved facilities. So all the questions that sits on those forms that I mentioned, they are captured actually in the system, and reports can easily be created from the system. Then future on-site sanitation and FSM projects could still be integrated in the system. We wouldn't want a situation where we start again looking for another system. I think what we normally do with the interested parties who are ready to partner with us is that they still have to use a system to report data, because unless otherwise the KPIs do not sit well and they are not in the system. Then what are some of the few lessons that we've learned on safely managed sanitation service delivery in Lusaka? One of the lessons we've learned is that quality data reporting requires continuous capacity building in SPs due to labor turnover. My people are quite critical in this aspect, and the caliber of the people that we are dealing with, sometimes you really need to be patient with them. You see, technology for them is something that, for lack of a better term to use, is new to them, and you really need to do a lot to build capacity in them. Not only that, the other lessons we learned is that system-based verification promotes efficiency and transparency. I think long are the days when we could physically go into Excel, begin to verify the jobs that are done in the system. This time around, I think the system is able to help us verify the volumes that are done in the system. But something to mention also here, I understand it's a software monitoring system, but physically also we have got a mechanism that we use to do what we call a physical inspection, that we physically go to the site and carry out the monitoring just besides the software component. Now, I know there may be questions that will come, but I think we are still around to answer questions. So my presentation was that simple and very short. I hand over to the moderator, and at the time probably when the moderator will guide whether we need to navigate through the system and yeah.
Thank you, Evans. Thank you, Kasalo, and thank you, Barbara. This was a lovely presentation. We have a number of questions that need to be attended to, but we also believe it will be a good opportunity for everybody within the webinar to just have a feel of the actual system itself. So if you could please take over and just share, that would be great. And please note, many of your questions will be answered within the chat, but there are some questions that will need some in-depth explanation, and those will be addressed during the Q&A session. Just a reminder, please keep your microphones muted. We want to have a smooth recording so that you may appreciate it later as you watch. Hey, Evans, if you're speaking, we can't hear you.
Oh, okay. Are you able to hear me now?
Yes, now we can hear you. Thank you.
Great. I was trying to switch rooms. Sincere apologies. So what you are seeing basically on the dashboard are those 5 components. So our service providers generally, they are given rights. So for instance, on the pay point, they do not have rights. So they can't log into that dashboard. So their rights only starts from the toilets. I hope you can see the toilets there. Then there's an aspect of customers. These are situations maybe where they remember servicing a customer, and instead of getting into the system and beginning the data capture freshly, they would rather search for the customer in this tab. Then on the toilet here, basically here is just if they remember a toilet, they can't remember a customer, but they have the data related to the toilet, they can search using a toilet number. Yeah, but when it comes to the service providers here, these are just, the module just basically shows the number of service providers that we've incorporated and licensed that were on a performance-based contract before we move to the permitting model. Then on this aspect of the FSTP, the rights are only given to the plant operators who are at the receiving end of the sludge. But of course, from the monitoring point of view, we are also able to have access to this because we want to monitor the movement of sludge, for instance, from the point where the customer aims until he or she arrives at the treatment plant. So at the point now, for instance, you have a new customer that you want to input in the system. So you just come to customers, then you add. There is an add tab here at the end of at my far right. There is an add. Then you add and input the requirements, not just to show how much time I have. Maybe let me just show you, but I may not go as far as creating a toilet number. So these are some of the information, basic information that sits on the physical copy of the general register for a customer, because the primary key here to get the data of the customer is an NRC. So once it captures the NRC, then it allows you now to navigate to the next stage now to pick the other details that are needed. So as you can see from here, you can now proceed to go and generate your toilet number. Yeah, but with regards to the FSTP at a plant, for instance, if now a service provider arrives at a plant, so the plant operator now would generate what we are calling a fecal treatment, a plant number that links this data now to where the sludge is coming from, so that we avoid for instance, a service provider telling a slice that I emptied 4 cubics. So once it generates this number, it will link it will link it to that toilet number, where now we will be able now to retrieve the data related to the customer. Then we can do what we are calling customer survey, because we have a number that is for the customer in the system. So basically, in a nutshell, I'm looking at time. That's what the module offers us. So whatever we listed from the job card, the assessment, the FSTP, including the receipt number, we just incorporated them into a software system so that we're able to report the data and capture it. Yeah, I think I end here. I'm looking at time. I don't want to go beyond the stipulated time, but if there are any other questions, please, we can take them.
Thank you so much, Evans. We still have the M&E module that Barbara needs to go over with us. So if we could quickly go over that and then have a quick break before we get into the Q&A session, that'd be greatly appreciated. Please keep sending your questions, comments, and remarks in the chat, and we'll definitely address them as we go. Thank you. All right, as the Lusaka team sorts out their audio, I believe we are at a well-deserved 5-minute break, and please keep having your questions come in. We will have Barbara back to share the M&E module of the Lusaka Sanitation system. And we shall start this 5-minute break now. Thank you. All right, welcome everybody. We are still going with the webinar. We will give Barbara 2 minutes. I hope the audio has been confirmed on our end. The Lusaka team is ready to go, and we shall quickly go over the M&E module on the Lusaka Sanitation system, and then go straight into Q&A. Barbara, please go.
Thank you very much. This is the dashboard for the monitoring and evaluation. It has the LSS portfolio. The LSS portfolio, that's where the data is being entered, and also the OSS portfolio. Then we also have the LSS analytics. That is where the reports being generated, as well as the OSS analytics. In the M&E portfolio, that's where you find, sorry, previous slide. Yes, this is where in the M&E, this is where you have the implementation framework and the results framework, and it will show you the different institutions that are using, which is the Ministry of Health, the first one, the Lusaka City Council, and the Lusaka Water. Next, please. This is just the program data entry form. The first time that requires that an institution is supposed to do is enter all the information that is required as they will be using the system. It has the general information, the location, the budget, and also the project section. Next. Then this is the results framework. It's just to show you the steps that in the system we have the indicators from the goal level, objective, outcome, and the output, and all these are linked to the activities. Next, please. This is an indicator passport. This is the one from the beginning. We had to give each institution this indicator passport so that they can give us the indicators. By the way, I need to mention at this point that we had to come up with an MOU with the 3 institutions and agree on the type of indicators that we were going to be tracking in the system, as well as the citywide indicators and the indicators that we report to the NOASCO. Next slide, please. This is just to show that in the system, in the analytics module, we have 2 types of placing the reports. So if you want the report to be seen by the public or for anyone to access these reports, you will save the reports in the public. But then if they are just personal and internally, for example, if the reports for just Lusaka Water, who need to access it, maybe your management, you use the personal, but for the public, anyone who ever requests data from Lusaka Water, they use that. Then this is also one of the examples of the data sets for Ministry of Health. This was, I think, during the cholera campaign where they were distributing some chlorines. This is all in the LSS analytics. You can produce such reports. Next, please. And these are examples of the reports. You can either you can play around with them. You can make pie charts, bar graphs, and so on, or tables. And on the side of the table, that is just a filter where you can scroll and choose the period you want for that report. If somebody requests, for example, just for May, you can filter and give them for a month, for a year, for years. That is, how is this data being used by these various institutions for decision making? For Lusaka Water, to monitor our operations and performance of the sanitation initiatives in Lusaka, we are using this to cover the clearance of the sewerage and the waste treatment plant efficiency. Then for the OSS, in this same LSS, this is where we manage to process across the sanitation service chain from construction of the on-site sanitation, which I showed, emptying transportation services to treatment of sludge at a designated site. Next, please. For LCC, they also monitor the standards as per their provision. It also involves regulation inspections of the conditions of the toilets, construction standards, the surface, the ground, and the quality surveillance and monitoring to curtail the illegal dumping of the fecal sludge and the septage into the environment. For the Ministry of Health, being the biggest ministry, it is to monitor the impact for the population, the impact of the sanitation, and how are people affected if we have an outbreak. What are our challenges and what is it that we want to enhance to this system? System development challenges. First of all, I think it is better to make clear the TORs before you start. I think we were excited being the first sanitation system. Our TORs were not clear, such that we had a lot of forth and back between the developers and us, the users. Each time we were using the system, we would want something new to be added to the system. And some of these things that we needed to be added were structural changes, which was not possible for us to do. Then we also faced a lot of transfers. You know, like from Lusaka City Council, there was a point when a lot of people were transferred, and this meant that the transfer of knowledge has to be continued on the system. Then the current version of this system is that the volume of the data for the sanitation mapping data, even though integratable, it cannot support. Then the current version also is not designed to cover the procedures such as the dislodging calendar, the scheduled dislodging calendar, also the FSTP receiving, because what we need is, under the project, we have constructed a way bridge, and we want this way bridge to be the data to be automatically automated into the system, and also the payment for the dumping fees. All these are not in the system, and these are the ones that these are the challenges, and they are on our critical path, that when we have this, the better. What I will just mention a few enhancements that we require, such as to improve the inspection, verification, and monitoring of the service providers. The inspectors, the FSM team, they have got a checklist which was not included to the system, which is very important to them as they conduct their monitoring. Then also the payment of the FSM service, the one that I have explained, such as the dumping fees, we want them to be paid direct in the system. And last but not the least, we want the LSS to be in the ERP as a sanitation module. What lessons did we learn? We have learned that if we integrate all the system, the ERP which is being developed by Lusaka Water, it will be easier because all the systems will be aligned, and once anybody enters, there will be no need for someone to start entering into another system because it is already aligned in the ERP. It is also important to ensure that end user capacity through deliberate trainings are very key, especially the staff that are being transferred anytime in this other institution. You may develop this set of staffs, then when someone is transferred in the ministry, some of them, they don't train others so that they continue. They still have to get back to us, then we still have to continue training them. Incorporating key partnership is vital in facilitating the efficient management of the information at the different steps of the sanitation service delivery chain, from household registration to final verification of construction of toilets, emptying services, to treatment of waste and customer satisfaction. Thank you very much, and I rest my case.
Thank you so much, Barbara, and thank you all that have been able to stay with us from the beginning to the end. As the Lusaka team has shown us, the data journey from collection to use has been one worth this webinar, and we do feel like we do need more time. So diving right into the questions, we have a question from Mr. Mike Mwale, and his question reads, given a project with the current progress of 33%, could the Lusaka team please provide information on the following: the project initiation date, challenges encountered? And I believe these questions were answered during the webinar. Mr. Mike, we would like to appreciate you for your question, but we just, to observe time, we might move to the next question. Question from Mr. Kennedy Kamau is, why is there a vast disparity between the population served, which is about 3 million, and the customer base, which calculates around 135,000? And do you maintain separate treatment plants for fecal sludge and wastewater? And would you also just give Mr. Mwale and Mr. Kennedy an understanding of the tariff structures, especially the subsidized models, as well as lessons and challenges which you have already touched on? And the final question would be, how would you coordinate the reporting of sanitation data from the districts, the province to the national level, considering SDG 6.2? And just a general comment, he believes utilities could move away from customer orientation as insinuating those able to pay, because people-centered, to ensure that we do not leave anyone behind, especially those in low-income communities whose ability to pay for services should not deprive them of safely managed water supply and sanitation. I'll allow you, Barbara, to answer those questions before we move on to the next question.
Okay, maybe I can start with the treatment capacities. Okay, sincere apologies. I wanted to attempt answering the treatment capacity. Of course, we are constrained with the treatment capacities, because I can tell you we have got 2 fecal sludge treatment plants that are specifically designed to treat sludge in 2 zones. So one of them is called 𝗟𝘂𝘀𝗁𝗃𝗃. Its capacity basically is less than 120 cubic meters. But when you look at the number of trucks that we are receiving in a day, it's over 3 times than what we are, than the capacity. So basically what we have done is just, we've made a provision where we are doing a co-treatment. So especially for septage, septage can easily be co-treated with wastewater. So we've made a provision just to cushion that demand. But one thing I think we've learned is the fact that we never anticipated that this demand could come to a triple case, or even more than that. Yeah, so those are the interventions that we are putting in place. We are doing basically a co-treatment. I hope I have answered the question. Then in terms of disparities in the customer base, again, it's the population. So the 3 million population is a citywide inclusive population, and actually the 3 million is a provincial population for Lusaka. So basically at the moment we are just servicing Lusaka city, and we are yet now to go into the whole province, looking at the fact that NWASCO has expanded, which is our regulator, has expanded our mandate to provide sanitation services also in remote areas. But at the moment, we are just basically providing sanitation services in the city, and most likely where this project is applied is in the peri-urban areas. So that's why you see the disparities in the population against the customer base that we are currently servicing. Yeah, then with regards to data reporting, some other questions. With regards to data reporting, so basically we report to our regulator, National Water Supply and Sanitation Council. So there are indicators that guides the reporting of data. Yeah, so basically when it comes to sanitation data reporting, for instance, we are required, for instance, to report how many households have been serviced, for instance, in a month in a certain zone. So that data it becomes easy for us just to go into the system and service them. Then with regards to, for instance, how many households are using, for instance, basic sanitation facilities or improvement facilities, those questions actually we frame them into it's either sitting in the job card or the assessment. So we are able to retrieve that data in line with the report requirement for the SDG. So we report to the regulator, then the regulator now reports to the ministry. Then the ministry eventually reports now to UNICEF. Yeah, thank you so much. I hope I've tried to attempt some questions, unless otherwise just there are other questions.
Thank you. Another question we received was the system an in-house developed system or was it outsourced? And what are the KPIs that are unique to the integrated systems? And another question is, how do you coordinate with other entities in regulating FSM operators in the sanitation space? And the fourth question is, how does the data you capture under the 3 modules feed into the Ministry of Health data and vice versa?
Thank you very much for those important questions. This system was outsourced. We had to outsource the vendor, and this was the Synergy International. They're the ones that developed the system. Then yes, this system has KPIs, and these KPIs are linked to the SDGs from the go up to down. When I showed the presentation, these KPIs, we also have included the KPIs for the CWIS indicators. And as for the Ministry of Health, this system at the district level, that is where our system begins. It is not integrated at the higher level in the EMIS because of the security reasons that we couldn't do that. But being a utility, we were allowed to get data from the district, the surveillance data. Same with the LCC. It was not us getting the data there, no. The Ministry of Health, environmental staff are the ones that are capturing the data which is going in the system. And the public health for the LCC, they're the ones that are capturing the data which is going in the system. So we are dealing at the district level and not at the province or the national level because of the security reasons.
Thank you. Just to answer the question relating to regulating of service providers, I think that's a brilliant question. Yeah, so basically what we've done is that we've developed what we may call a standard operating procedure, FSM standard operating procedure. So remember, the utility do not have power to enforce, So what we did is, because of the delegated business management model that we adopted, we needed something that is going to bind us between the service operator, who is a third party in this case, because the regulator allows the third party, of course, to be incorporated in providing this safe managed sanitation service. So we developed what we call FSM standard operating procedures that are basically our guideline that helps us now to regulate the service provider. So in that standard operating procedures, it basically enshrines of the do's and don'ts of the service providers. And of course, we've got requirements for service providers to come on board, because remember, the regulator, we report to the regulator NWSCO. So National Water Supply and Sanitation cannot directly deal, for instance, with the service provider if they find a fault. So instead, they would hold the utility accountable for that. So to cut the long story short, we've developed an FSM standard operating procedure that binds us in the performance-based, in the contracting strategy.
Thank you so much. Yes, so just while we still have you here, Mr. Evans, another question just came in regarding the FSM standard operating procedures. And Loretta Roberts is wondering if you could share these standard operating procedures. But before we address that, question is, based on the data that you collect, what type of analysis is the platform capable of producing? We do understand that you showed us a little bit on the type of analysis that the platform can produce, but it was quickly brushed over. Another question is, are you comfortable using this system as a standalone, or are there plans to integrate it within the utilities ERP system? And the final question is, how do you coordinate the reporting of sanitation data from the districts, the province to the national level? Something that I do believe you Barbara touched on. Thank you.
Okay, so maybe before I move the mic to Barbara, with regards to data analysis, for instance, I think the system is able to help us, for instance, analyze how each service provider is performing against their set targets. I'll tell you, when we started, we only contracted 6 service providers, but I can tell you that the number of toilets that we are bringing as IPs in the interim payment certificate, because it's an incentivized system that we are running. So they would bring toilets as much as 600 toilets. So for us to enter all those 600 toilets, it became a bit challenging, and analyze them using Excel. So the tool is able to help us basically do a performance analysis of each service provider. Not only that, remember, the service providers are taking this the two treatment plant. So if you want to assess, for instance, the capacity of the treatment plant, it may be tedious to start counting number one vehicle, but when you go into the system, it will tell you to say that today, this is the amount of capacity that has gone to the plant. So it helps also the plant operators or the engineers to plan the receiving of the service providers. So it has a lot of analysis actually beyond just analyzing the performance of each service provider against their KPIs. Then if this system is standalone, I think the idea is that it will be integrated into the main system that is EDEMS. So when it's integrated, so everyone will still have, the reporting system will still be the same, but we would want to use a holistic system as a utility, where even the sanitation service provision reports sits in EDEMS. Yeah, to let it as a standalone may not be the best idea for us. I'm not too sure what other question was asked, Chisanga.
How you coordinate the reporting of sanitation data from districts, province, and national level, but you did address that earlier. Unless you
okay, then in terms of sharing the standard operating procedures, the Lusaka Water Supply and Sanitation Company runs what we call an open door policy. So we'll be glad to share that with you. But something just to mention is the fact that even ourselves, actually, we just started from scratch. We just started from scratch and developed something, and we kept on changing by and by. So there's no need to worry. You can just write through the CEO and we can share this information with you. Yeah, we'll be glad to do that. Thank you so much.
And we have one more question from Elizabeth at SOS. Great presentations. Their observation or question goes to Barbara. Question is, you showed the sanitation facilities you're providing to the community, and you were talking about inclusive sanitation, and she had noted that the toilets have stairs. How is Lusaka Water Supply and Sanitation incorporating people with disabilities in the solutions you're designing for the community?
Sorry. Thank you very much for the question. Not all the toilets would ask the customer if they had a person who is disabled. For those that had disabilities persons at their homes would definitely put that, but in the public toilets that was a must. But for the households, some of them would say, no, I don't want this, I don't want that. We were just following the specification from our customers. Thank you.
Thank you so much, Lusaka Water Supply and Sanitation Company team. You have laid a very insightful presentation, and thank you for the insightful questions and discussions. To wrap up, we'll discuss the next steps following today's webinar. We shall be sharing the recording of today's webinar along with additional resources and materials related to the Lusaka sanitation system. So if you do feel you may not have captured certain information, this recording will be made available to you. We do also highly encourage you to stay engaged with us as we continue the series of webinars. We will have a series of webinars all the way till 2026, and we will continue to provide technical assistance to those interested in implementing similar systems within their operations. I also highly advise you to scan this QR code just to get involved in Dev-Afrique's public data systems strengthening project. Thank you so much. Thank you all that were able to join, and have a lovely day or evening.
Goodbye. Thank you, Chisanga, for moderating.
Goodbye.